Thank you.
5 minutes between the two of us? Okay, here I go. We talked about community-based prevention, and of course, I think the first most important conversation question was what is community? And just another one of these unresolved issues about what does community really mean and how does that affect what we're going to do in terms of prevention. And then where should the prevention occur within the community, however you define it, whether it's a primary prevention or later on. And, perhaps looking in terms of community-based prevention at other successful movements and models like domestic violence and child abuse. And someone raised, I think it was Kathleen, about the issue of the important role of the political muscle in some of these earlier movements and how important those were, and how that's going to help or not make successful really getting this moving forward. We spent a lot of time also talking about coalitions and the value and power of coalitions really as the infrastructure of intervention, and also really about multidisciplinary teams, which seems to be, and I'm very excited about it, that it's a really important theme that's come out of the last 2 days, how important it is really to work in a multidisciplinary way in community. And I think it's true not only in community in different agencies, but even within one agency working in a multidisciplinary way. I know in the shelter, working within a system, but all the different departments working together, it doesn't work unless everyone really works together. And I think that's part of the beauty and value of what we see here in terms of community and really having this conversation. And I'm going to let Dr. Hall go, but I think also one thing, and it was a lively conversation, is kind of, I think the conversation between the difference of the just do it model, just get out there and do it, and the other process, which I think he'll talk about a little bit, and kind of the tension a little bit, I think, that arises in that conversation of the airplane being designed as it's flying, and the comfort to be able to do that and to get data and information and to make change and to really touch lives in that model.
Okay. Well, I think Joy did a really good job of summarizing some of the many things we touched on. And what I'm going to try to do is just bring some of it down to the ground. At the core, one thing we quickly realize is people speak different languages. So when we even talk about this idea of community, understand that people's definitions of communities will reflect which particular organization they may represent or their particular experience with the phenomenon of elder abuse. And so we have to have that first and foremost in mind as we talk about trying to partner together to do work to prevent this. Also, in terms of talking about this idea of partnering and the idea of bridging relationships between stakeholders, we think that a key factor that we have to hold first and foremost in mind is that moving forward, we're going to have to more and more depend on non-traditional partnerships to bring groups and individuals to the tables in ways that they haven't in the past, so that we have all hands on deck, if you will, to be sure that this is a phenomenon that we stamp out at some point in the future. As we embrace the different stakeholder groups, one thing we have to be able to do is activate older adults themselves. We talked a little bit about the baby boomer generation and how to empower them and awaken that inner power that some people have recognized probably that's there economically, to really take control over this issue and use their passion and their power to help us make this something that is removed from our society. We also have to, as we have this larger conversation about evidence, just understand that as we move towards an evidence basis for doing this, there is going to have to be some action happening. So a reasonable accommodation would be to have guided exploration of the particular activities that groups employ to address elder abuse to occur in such a way as to allow us to collect information so that we begin to compile that evidence base from which we can launch future activities. Finally, going back to this idea of frameworks for just a moment or so, we have to bring this down to a level where frameworks don't become barriers. So in other words, as our conversations happen, we have to realize that we got to talk about them in ways so that everyone understands basically what we're talking about, as opposed to getting focused on concepts. We had a lot of talk about the public health model, for example, which I personally have a bias towards because that's where I work within. But essentially, we need to be able to talk about and interact with that framework in a way that allows us to speak to those who we're working with. So instead of talking about ideology or surveillance, we can talk about data collection. focusing on the causes of elder abuse, focusing on developing effective interventions, and then being able to share and spread the things that we find to be effective in ways that allow communities to pick them up, adopt them, or adapt them in ways that are ultimately going to be very functional. And lastly, we got to realize there are going to be a lot of contextual and setting based factors to consider. Politics, as Pam Teacher said a little bit earlier, have to be considered. And we also have to think about the fact that you've got very intrinsically important situations in place, such as the familial relationships that are involved in situations of elder abuse. One person in the group mentioned that we have to talk about family relationships and doing something to let people figure out how they're going to deal with the possibility that they may have to implicate one person or many people that they care about in their own family network to do something about this problem. So our communications on the community aspect were very lively, and what they did is gave us a basis for thinking about some of the issues we'll have to deal with to make some headway to address elder abuse that occurs in a domestic context.
Okay, thank you. Please join me in a round of applause for all of our panelists.